Honestly, I think that with our screening modalities getting more advanced and patients feeling more comfortable, the most recent generations I feel like are wanting to get answers, wanting to come to the doctor. There's a lot more autonomy involved with those generations, kind of really like, not just, oh, this is what the doctor said, but making that plan together, where I feel like some of my older generations, were in the thought process where, well, I was done having kids, so, they'll come to see me, now they're 75 with a problem, but they haven't seen a gynecologist since they were 37 when they had their last kid. So it's actually more that generation that I find kind of has that gap where other patients they're on top of it every year.
Yeah, so there's never really an age where you shouldn't stop, or stop. You should keep going, and again, that's a conversation that they're having with you or your partners to just make sure that those are scheduled and routine. And
well, and that's a question a lot of patients have too. They'll come to see me and say, well, when am I done with this? Like, I love you, but when am I done seeing you every year? And a lot, we'll have the patient that come in who's 50 years old and not in the best of health, and maybe on oxygen and in a wheelchair. And then I have the 85-year-old who, after she leaves, she's going to the gym and she's watching her grandkids. So it's a big spectrum of how they present, and there's no real endpoint for like breast screening. So typically in our 80s, I start having that conversation of, it's a screening. If we found anything, would you do anything? And that's usually when they start having the conversation about when do you stop colonoscopies. Pap smears do have an endpoint. Those stop at 65 as long as they've been negative. So, but I always tell them not a reason not to come every year after that, because there's other parts of the exam that we do.